Dumalang, doctor. Lekai? Busy day.
Yes, busy day ahead of us today.
State healthcare is too often a bad news story. But we're seeking out professionals providing excellence against the odds. We're at Dihlabeng Regional Hospital in Bethlehem.
Grade 9, that's when I decided helping people, saving lives is what I want to do.
We're tagging along on the morning rounds with intern Dr. 𝗀𝗶𝗶𝗴𝗶.
Hello.
Hi, Lesedi.
Dihlabeng Regional Hospital takes referrals from 5 district hospitals and is a vital provider of specialized care in the province. But it hasn't always featured in the media for positive reasons.
In 2015, the hospital hit the headlines for medication stockouts, dysfunctional infrastructure, and a desperate staff shortage that meant it couldn't run a 24-hour service.
We hit rock bottom, and I think there was about 4 permanent doctors left, that other than the specialists. And at that stage, I decided I don't want to leave it like this.
Dr. Liam Selfridge was appointed clinical manager in 2015. Since then, management has worked hard to pull the hospital back together.
You don't lament. You don't say, we don't have this, we don't have that. You say that I'm able to do this in spite of challenges, rather than saying I can't do this because of challenges.
After 2015, everything changed.
Acting head of nursing, matron 𝗀𝗫𝗀𝗃 has been at Dihlabeng for 22 years.
It's called the Hospital of Death.
Now it's not hospital of death.
Now
That's
you're getting
where
compliments.
We really do get compliments, as much as sometimes we do receive the complaints, but which are being addressed immediately.
And these patients awaiting surgery seem to agree.
The treatment here?
The treatment is very good.
It's good. So you're in good hands.
I'm in good hands.
A little bit nervous, but I know Dr. 𝗀𝗃𝗃 is an excellent doctor.
And what are the staff like? The nurses?
No, very helpful and very sympathetic.
We still challenge with the staff availability, but our staff having willingness to go as far as they can to reach the patients, I think that is the one that make me wake up in the morning and calm.
Dihlabeng now runs a full 24-hour service and is a desirable location for young doctors in training.
They tell you that by the time you leave here, you're going to have enough tools to go into the real world where you're a doctor on your own. And we see a lot of passion in this hospital.
You know, after 27 years, I'm still here because I think we can make a difference. We can help with the training of the junior doctors.
That's what's kept you here.
Yeah. And I think I'll still be here until they chase me away when I have to retire. So.
We've accompanied Dr. 𝗀𝗀𝗃𝗏 into the operating theatre of Dr. Johan Vermaak.
What the staff and the management of this hospital is doing, they're doing the best that they can with the financial constraints. We haven't got patients waiting longer than 3 to 4 weeks for an elective op.
Yeah.
And I think that's not many state hospitals that can say that.
Thanks, Doctor. That was quite enlightening. You were doing a lot of work there. Huh?
Not as much as the surgeon.
Yeah, but I mean, you were doing well there, 𝗀𝗀. I'm not Dr. Watts, but from what I've seen in this hospital, when it comes to patient care, surgical procedures, and the passion of all of the healthcare workers, if other hospitals around the country could emulate this, I think we'd be pretty close to world class. You said in 2016 that you want this to be the best hospital in the Free State.
Everyone has their challenges. But Dihlabeng has stood out mainly for service delivery, right across the board, from surgery, anesthesia, orthopedics, and internal medicine. Every head of clinical unit has been here for more than 10 years and some 20 years.
We work around the challenges.
So you wouldn't claim that the hospital is perfect?
No, I would not claim that it's a perfect hospital, but we are fighting to make sure that our patients are on top.
Well, that wraps up Dihlabeng Regional Hospital in Bethlehem, and it was quite a surprise for us.
Next, we're headed to Chris Hani Baragwanath Hospital in Soweto to focus not on frontline medicine, but rehabilitation.
It's not just about saving lives. It's also about the quality of lives once they're discharged from hospital.
Dr. 𝗧𝗵𝗶𝘀𝘆 has headed the speech therapy and audiology department since 2001. It's been recognized for many innovations, including the first cochlear implant in a state facility in 2006.
When we reach a hurdle and when we're told something can't happen, we look at how else can we make this happen.
More recently, the pandemic lockdown sparked another innovation.
Telehealth has existed in the world for some time. And so what that means is it's been possible to see a family or a patient who is not with you virtually. But up until then, that had not been permitted for us.
Danny Schlesinger coordinates the cochlear implant team.
Surely a lot of your patients don't have the latest laptops and tablets.
The first thing that we did was we contacted all of our patients to say, what do you have available? And then we catered an individualized telehealth plan for each patient based on the technology that they had available.
Although lockdowns have ended, the majority of Katia Saris's patients still choose telehealth.
We get siblings to join in on sessions and uncles and aunts to join in on sessions, and you're doing therapy with them in real time in their environment.
How are you? That's good.
𝗀𝗁𝗂𝗁𝗆 relies on one cochlear implant and a hearing aid. Telehealth makes life a little easier for her mom, Cindy.
When she comes from school, the department is closed at the hospital, but her speech therapist will go an extra mile and do after hours. I don't need to be absent at work to take her to a speech, so I can do it at the comfort of our own home. Say high five to your sister, she's doing fine.
Because you're not there, the ownership goes straight on to the parents. So you're actually counseling the parent on what to do, and they're learning the skills.
Both patient attendance and outcomes have improved dramatically.
Our goal was to find a substitute for therapy when someone can't come in. And I think what we've realized is that, in fact, we've really been able to offer a much richer package with it.
COVID compounded many of the challenges we face in this country, like unemployment and access to basic health care. But it also sparked life-changing innovation.
Their services, they are out of this world. They are above the private facility. Sometimes you need not to listen to stories, you need to go there yourself.
I'm working at a hospital because my patients have a right to the best. There should never be this thing that comparing ourselves to private healthcare, because for me, that is not the benchmark. The benchmark is actually what our patients are saying to us about the services they get.
It can be hard not to believe that the challenges in our healthcare system are insurmountable. But perseverance, passion, and strong leadership really can produce excellence.